My name is Meredith, and I am a pediatric nurse here on James Island. I live here with my husband and my two children, and my dog Penelope. The injury that I had occurred over several years of being a nurse and being at the bedside and being on my feet and about maybe running into things, kicking beds, things like that. And over time, I ended up with several bone fragments that were inside of my foot. My big toe fused together with my whole foot, and I was not able to have as much flexibility. So with every step I took, if you think about your foot not being able to flex, so I wasn't able to flex. So every single step was painful, and I went through it for a few years, more years than I'm sure Dr. Brown would have liked me to, for someone that's being a nurse and being on your feet all the time and having small children as well, it doesn't work very well, but it was very, very painful. I found out about Charleston Foot and Ankle Specialist through a friend of ours. He is a very close family friend, and he is very much athletic and very active, also in the military. And he had gone and at that point not even had his surgery, but had gone and saw them. He's very judgmental and very picky, and he loved them. So I was definitely in. And of course, kind of being in the healthcare field as well, you have to be. I'm really careful, and I get really picky about who I'm gonna select. And their office was the only office I went to because Dr. Brown was just great right from the start. So it was the right choice. They are absolutely welcoming. It wasn't the pressure of give me your insurance card and give me your copay. It was nothing like that. It's a very nice, welcoming waiting room. It's a small office, so it's just you're all right there together. I don't know. It feels like home. Everyone's very nice. To any of my friends that are nurses and physicians, any healthcare providers, that we are all on our feet all the time, absolutely for them, because we do need, as in that profession, you do need a quick recovery time, or you need to know exactly when you're going to recover, when you're going to get back to work, because you have patients depending on you. So it is very important for them. But I also have been known to recommend Dr. Brown to random people I see, like, oh, my foot hurts. And I said, well, hey, there's Carolina Foot and Ankle. Here's look them up. And we did that with my daughter. We were at a kids event, and one of the moms, they happened to see me, and we were talking, and she was limping, and of course I'm a nurse, so I asked her why, and she told me she was having all this foot pain. I said, oh, here you go, Carolina Foot and Ankle Specialist, you have to call Dr. Brown. So she did, and she made an appointment. So people go, and it happens, sometimes I think too, with being a nurse, you get to be in a really trusted profession. So I would never recommend anyone that I didn't believe in and personally knew that was just great. And so people take that to heart. They look to me, and they look to a lot of us, as nurses and things, and they trust us for our opinion, and I definitely would recommend it.